everyone, I am Regine Chris Francisco Yadaw, a registered midwife and a Bachelor of Science in Midwifery student in University of Eastern Pangasinan. And for today, I'll be performing a head-to-toe assessment or complete physical examination. What is a head-to-toe assessment? A head-to-toe assessment refers to a physical examination or health assessment, and it becomes one of the most important components of understanding a patient's needs and problems. The head-to-toe assessment includes all the body systems, and the findings will inform the healthcare professional on the patient's overall condition. And any unusual findings should be followed up with a focused assessment specific to the affected body system. A physical examination involves collecting objective data using the techniques of inspection, palpation, percussion, and auscultation.
Inspection. Inspect each body system using vision, smell and hearing to assess normal conditions and deviations. Assess for color, size, location, movement, texture, symmetry, odors, and sounds. Palpation requires you to touch the patient with different part of your hands using varying degree of pressure. Wear gloves when palpating mucous membranes or areas in contact with body fluids. Percussion is a method of tapping body parts with fingers, hands, or small instruments as part of a physical examination. Auscultation involves listening for various lung, heart, and bowel sounds with a stethoscope.
Nota bene. Because of palpation and percussion can alter bowel sounds when assessing the abdomen, first thing to do is inspect, auscultate, percuss, and palpate.
The primary goal of standard precaution is to prevent the exchange of blood and body fluids and includes hand hygiene, use of personal protective equipment, and safe handling and cleaning of potentially contaminated equipments or surfaces. Asepsis covers all those procedures designed to reduce the risk of bacterial, fungal, and viral contamination. First thing to do is perform hand hygiene. Check room for contact precautions and apply principles of asepsis and safety. Here are the 5 points of hand hygiene. Before touching a patient, before clean or aseptic procedures, after being at risk of exposures to body fluids, after touching a patient, and after touching the patient's surroundings. Introduce yourself to patient. Introducing oneself is common courtesy and should be routine, automatic practice at the start of any consultation, be it with a patient, a family member, or a colleague. Not only is it courteous to introduce oneself, it helps build rapport and is a safety issue. Knowing the role of the person ensures that information is conveyed in a way that will be clear and takes into account the person's training and experience. Hello, my name is Regine and I will be your midwife for today. Confirm patient identity using 2 identifiers. For example, name and date of birth. What is your name?
Christian Louis Sayabok.
Christian
Louis
Sayabok. Okay. Kindly state your date of birth.
December 2, 2012.
December 2, 2012. Okay. What may I call you? Would you prefer if I will call you Louis?
Yes po, ma'am.
Okay. Okay, Louis. explain process to patient. So, Louis, I am here to perform a head-to-toe assessment, and we will be starting this by getting your height and weight, checking your vital signs, or what we call the general status. Then, next, the head, ears, nose, throat, your neck, facial features, your lungs, abdomen, your lower extremities, and also your neurological functions and skin. Okay? Do you understand, Louis?
Yes po.
Okay. I will start this by asking you a few questions. You may answer yes or no. Okay?
Opo.
Okay. Do you have any problems with your skin?
No, ma'am.
Okay, no. Any problems with your visual,
No, ma'am.
your hearing,
No, ma'am.
facial features,
No, ma'am.
any problems with breathing,
No, ma'am.
difficulty in breathing?
No, ma'am.
Do you have any depressions lately,
No, ma'am.
anxiety,
No, ma'am.
or stress?
No, ma'am.
No. Okay, Louis. May I request to please stand up and let's get your height and weight and to be followed the vital signs.
Okay po, ma'am.
Okay. 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 I will record your height and weight. Just get your temperature. Okay. Next, your pulse rate. Your RR. I will observe it for you. Your blood pressure. Head. Examination of the head includes inspection of the face, skin, hair, scalp, and skull. Begin by observing facial features, understanding that they may vary by sex and race. Inspect the eyebrows, eyelids, palpebral features, nasolabial folds, and mouth, noting any asymmetry. Examination of the head and neck is a fundamental part of the standard physical examination. It is typically one of the first part of the physical examination and is performed with the patient in a seated position. Because a complete head and neck examination is lengthy, it is usually tailored to the patient's history and presenting complaint. Inspect the skull and face. Inspect the skin and scalp. Palpate skull. Assess facial sensation and motor function. Louis, same ba na nararamdaman mo? Both side?
Yes, ma'am.
Ito? Tsaka ito? Nararamdaman mo?
Opo.
Dito?
Yes, dito.
Trigeminal nerve function is a nerve responsible for sensation in the face and the motor function such as biting and chewing. It is the most complex of the cranial nerves. Okay. Okay, Louis, try to furrow your forehead. Facial nerve function. The facial nerve is a pathway from your brain to certain muscles in your face. It controls muscles that help you make expressions like raising an eyebrow, smiling, or frowning. This nerve is also responsible for most of your tongue's taste sensation. Okay, Louis, next natin is whispered voice test.
Okay po.
May ibubulong ako sa'yo sa magkabilang tenga mo para i-test natin kung naririnig mo.
Okay po.
Okay? Start tayo dito. Sa left ear.
Hamburger.
Yamberg. Very good. The other side.
Jolly hot dog.
Okay, good job. Okay, next. Ito naman ang finger rub test.
Finger.
Sasabihin mo kung naririnig mo dito sa side na to. And then follow isa sa kabilang side. Kung may naririnig ka, okay? Sige. Naririnig mo?
Opo.
The other side. Naririnig mo?
Opo.
Okay.
What is a Snellen eye exam? The Snellen eye chart is the eye testing chart used by eye care professionals to measure visual acuity or how well a patient can see without glasses or contacts.
SHAKEYS.
Okay.
SHAKEYS.
Okay, both eyes.
SHAKEYS.
Can you read it?
Shakies.
Okay. Okay. What direction I am pointing?
Up, down, left, right. Up, down, right, up, right, left, down. up, right, left, down.
Okay, cover mo yung isang nose, then sniff. Okay, the other one. Again. Okay. The 5 points of auscultation of the heart includes aortic, pulmonic, tricuspid, and mitral valve, as well as an area called Erb's point, where S2 is best heard. The 5 points of auscultation of the heart center around the heart valves and allow the listener to hear detailed mechanics of each heart valve. Aortic. Second intercostal space at right sternal margin. Dub is louder in this location. Pulmonic. Second intercostal space at left sternal margin. S2 dub is louder. Erb's point. Third intercostal space to the left sternal border. Erb's point where S2 is best heard. Tricuspid. Sounds are typically heard in right sternal margin of fifth intercostal space. Variations include over sternum or over left sternal margin in fifth intercostal space. Mitral apical pulse. Sounds are heard over heart apex in fifth intercostal space in line with middle of clavicle. Auscultate anteriorly, start at the apex of the lung, which is right above the clavicle. Then move to the second intercostal space to assess the right and left upper lobes. Move to the fourth intercostal space. You will be assessing the right middle lobe and the upper lobe. Lastly, move to the mid-axillary are at the 6 intercostal space, and you will be assessing the right and left lower lobes.
The 4 quadrants of abdomen.